Thanks, everybody, for inviting me to talk to you all. It's quite intimidating being up here and talking about yourself and your personal story, because not all of us, like to look in the mirror that often and look critically in the mirror. So I thought I'd tell you a little bit about some of my backstory, because I have not had a really linear path. Some of us can tell very linear stories about how one step connects to the next, but that's not my story. So when I finished residency, I was very interested in public health. I did a master's in public health and got very excited by epidemiology, vaccines, global health. And then I went on to fellowship, and I did my fellowship at CHOP in the late 80s, and CHOP was a virology place. It was hardcore virology. There was not a clinical epidemiologist anywhere to be found. But I had the good luck of finding a mentor in Paul Offit, who is very excited and passionate about developing a rotavirus vaccine. And so I was able to find a way to take my interest in disease prevention and in learning about pathogenesis and apply it there in the lab. And I loved it. I was in the lab for 8 or 9 years. And that really suited me for that part of my life. But as it came time for me to write an R01, I kind of picked up my head and said basically to myself, to my spouse, wait, there's a few things here that don't suit me as well as I would like them to. And it's up to me to make that change. And I wanted something that was more social, a job that was more social, a job that allowed me to find questions that needed answering that had more immediate clinical applicability than I was finding in the lab. And a friend of mine said to me, so have you ever thought about doing infection control, whatever doing infection control means? And I said, no. But I started to ask around. I talked to the people at my hospital who had previously done this and got their take on it. I picked up the phone and I called the 2 people I knew best in this area in pediatric infection control, who were incredibly generous with their time and told me about what it was like. And that was Don Goldman and Jane Siegel. And they became, over the next 6 months or so, my mentors from afar. And I'd really encourage you, no matter what field you are in, if you're in a place or in a field where you want to grow and develop and you don't have somebody locally who seems quite the right fit, reach out, because most of us love talking to people entering our areas. So I entered infection control, and fast forward it probably 15 years later, this is my world, this is my passion, this is where I'm going to stay. But I've had a lot of variety in what I do since then. I won't bore you with each and every step, but when I thought about this, I thought I'd highlight a couple of different aspects that are true for me in my work in infection control, and I think might ring true to many others when you think about what are the attributes of having a really satisfying, sustaining career. And so the things that I came up with were variety, challenge, a sense of mystery in the work that you do, recognition for your efforts, and then finally, the kind of catchphrase that sometimes I bridle at, which is basically helping others. And I think all of that's available in infection control. I know it's available in a lot of other areas, but I thought I'd tell you little tidbits about what days in my life have been like addressing each of those. So first, variety. When I started doing infection control, one of my very first meetings that I had to hold with people from all over the hospital was, how are we going to be ready when SARS comes to North America? And that was a really tough meeting to have. The next day, however, I got an even tougher phone call, which was from the scrub nurse in the cardiac OR, saying Dr. X is bouncing off the wall. They have just pulled a retractor from a child's chest that has attached bioburden. What is he going to do? And so there's a sense of huge variety, huge challenge, but something that gets you excited, stretches you, teaches you new things about medicine, about people, about yourself, that I think have really sustained me. In terms of recognition, there's a lot of recognition that comes in infection control work, not all of it positive recognition. You're the person who has to go up to the ICU and say, I'm sorry, but look at this infection rate for bloodstream infections. What's going on? But the other part of this is that every single person wants to do the right thing. And so it's all in the framing, it's all how you talk to people, it's all in your capacity to remember nobody comes to work wanting to harm a patient. And so if you're able to walk through a door with difficult to discuss data with that perspective, there's often a way to begin the conversation on a friendlier term and actually advance it. The other part of recognition is something that I find is really fun, which is that I know people throughout the hospital. I love walking through the hospital and saying hi to my friends who deliver the food trays on the cardiac floor, or to the member of the board of trustees, and everyone in between. And it is a high visibility job, but it's really exciting to know people at so many different levels of the hospital and have things in common with them, things of importance to talk with them about. And then the last thing I thought I'd mention are research opportunities. And the research opportunities, I think, in this field are huge. There, as Jason has mentioned, really getting to be some true dedicated funding to do work in the area of antibiotic stewardship and infection control. I have funding right now from AHRQ, the CDC, NIH, and foundations. And so it really is possible to build a research career in this area. I've also been able to take what I learned how to do locally in my hospital and begin to apply it and learn how these issues can begin to help settings very different from our hospital in Philadelphia, doing work in Zambia and Ghana and Greece. And so I think the possibilities, I would argue, for a career in infection control are really limitless. And I encourage anybody who has any inkling of interest to pick up the phone and call me or drop me an email. I'd love to talk to you more about it.